Hello, everyone. Welcome to Munson Healthcare's virtual press conference. Today is Tuesday, April 27th, 2021. My name is Diane Mihalik. I'm the Chief Marketing and Corporate Communications Officer for Munson Healthcare, and I'll be your host today. Next slide, please. Munson Healthcare has been hosting these COVID-19 press conferences for most of 2021, trying to keep you informed of the latest updates, including information on vaccines and variants and hospitalization trends. Other ways to stay connected with Munson Healthcare throughout the week. We encourage you to sign up for our e-newsletter that's sent out about every 2 weeks. Follow us on Facebook, LinkedIn, Instagram, Twitter, or YouTube. Or the latest updates are always posted at munsonhealthcare.org. Next slide, please. So I'm excited to have a few guests joining us today. We're going to welcome back Dr. Christine Nefsey, the Chief Medical Officer for Munson Healthcare. She'll be giving us some latest information on data in Northern Michigan, as well as some information on vaccines. And then I'm really excited to have two new guests joining us today. The first will be Dr. Jim Jacol, who is the Chief Medical Officer for Munson Healthcare Charlevoix Hospital, and he is also a doctor of obstetrics and gynecology. And also joining us for the first time today is Dr. Stacy Sensor, who is an OBGYN with Munson Healthcare at Otsego Memorial Hospital and Grayling Hospital. So we're excited to have those two experts in obstetrics and gynecology that can help answer a lot of the questions we've been receiving related to vaccine and pregnant women and women's health issues. Next slide, please. So without further ado, it's my pleasure to welcome back Dr. Christine Nefsey, Chief Medical Officer for Munson Healthcare. Welcome.
Thank you, Diane. Well, I am happy to report today finally some good news in our numbers. So you can see here our percent positivity rate is down to 14%. That's about 2.5 percentage points lower than what it was last week. And that is definitely a good trend that we are seeing. Next slide. Unfortunately, that trend has not yet translated into a decrease in our number of hospitalizations. Last week was our peak in hospitalizations. Quickly after that, it went down slightly, and we've really been maintaining about that 90 number for our inpatient COVID positives across our system for the last week or so. Next slide. So you can see here kind of that in a graphic form. So there's our current surge, and you can see that that has flattened out slightly over the last week. We continue to see good news as well on the vaccine front. So Munson Healthcare, again, working very closely with our primary care providers, our local health departments, and in our mass vaccination clinics has been able to give or distribute over 73,000 doses of vaccine. Next slide. Everybody probably did also hear there has been an increase, or sorry, a renewal of the Johnson & Johnson COVID vaccine. So we have resumed giving that vaccine. It's important to understand that, you know, that brief delay in giving it was done for safety reasons, and now the FDA, CDC, and ACIP now are saying that they have strong confidence that the vaccine is safe and effective in preventing COVID-19. When they dug down deeper into the safety concerns that had been elevated with that original 6 cases, what they're saying now is that if women in the younger than 50 years old, so it's, you know, basically kind of the 20 to 50-year-olds that they were seeing this in, should be made aware of the risk of adverse event around clotting, basically. It is, this Johnson & Johnson vaccine is available now for those 18 years of age and older. There is a warning for women between the ages of 18 and 50. And any symptoms that are developed within 3 weeks of after the vaccine that are consistent with either severe or persistent headaches, blurred vision, shortness of breath, chest pain, leg swelling, persistent abdominal pain, easy bruising, or tiny red dots that you see under the skin should all be seen by a provider. If any of those patients, if they develop any of those, should be seen by a provider immediately. Next slide. We also wanted to talk a little bit about the variants. We continue to see high numbers of variants both in Michigan as well as across the United States. So there are a number of them there that are being tracked. The B117 is the most common, at least in Michigan and probably across the United States, but that's the one we're seeing the most in our state. But we are seeing evidence of all of those variants. And the one added, you'll see at the bottom, is the India variant, and that was, we had a case of that in Clinton County. So that is also something that we're following closely.
I do have two questions for you, Dr. Nefsi.
Mm-hmm.
One is related to the hospitalization trends. You know, today we're reporting, or as of last night, midnight, we were still at 90. Mm-hmm. Are we seeing any difference in the acuity of those patients or the types of care that they need?
Yeah, it's been about the same. So, you know, obviously anybody that's hospitalized is sick enough that they require hospitalization. We've been reporting for a long time that the acuity is different than it was early on in the pandemic. So we're seeing consistently fewer ventilated patients, but are continuing to see patients that need oxygen in various forms. So we continue to see that. That has not changed. The acuity in our ICUs and critical care units is still high, and those units are quite busy. I think from a state perspective, additionally, one of the things that we haven't seen drop down at all are our pediatric admissions. So we continue to see 8 to 9 new pediatric admissions across the state for COVID-19. So there, you know, we still continue to see the spread and then the impact with that as well.
Thank you. And just the second question before we move on is related to the Johnson & Johnson vaccine, because that was reinstated. Is Munson Healthcare currently offering that? And, you know, with the advice for women within that certain age category, you know, earlier in the pandemic, people really couldn't choose which vaccine they would receive. And do you know is there a way to do that now? And I know you can't answer for the health departments, but through Munson Healthcare, what do you know?
Yes, I think, you know, it really depends. So we didn't get a large amount of the Johnson & Johnson vaccine when it was first distributed. So, you know, we don't have a lot of it. And a lot of people, I think, since it's a one-dose vaccine, we're using it for kind of specific populations. So, you know, certainly depending on where you go, there are lots of options for vaccine out there between our pharmacies and our primary care providers and the health department. So I think if people feel strongly one way or the other, that they want one particular type, there's certainly a little bit more choice now than there used to be. But I do think it's important to understand too, you know, that we're weighing a relative risk here between the risk of, you know, potential sequelae from COVID versus the vaccine. So again, if people have questions, I would invite them to talk to their primary care provider. And we also have our nurse advice line where people can call if they, you know, are seeking information about that. But there are some options out there now, certainly much more choice than when we first started our vaccine efforts.
Great. Thank you, Dr. Nefsi. Are we able to advance the slide deck now? There we go. So, okay, Dr. Nefsi, thank you for that update. We will have you back in a minute for the Q&A session. But next, it's my pleasure to introduce Dr. Jim Jacol. As I mentioned, he's the Chief Medical Officer for Munson Healthcare Charlevoix Hospital, and he's also a Doctor of Obstetrics and Gynecology. So, Dr. Jacol, what are you seeing in your practice now and throughout the region?
Yeah, I think I can just kind of go over some vaccine-related issues with pregnancy. I think I seem to spend most of my day these days talking to patients about the vaccine. As most people are aware, initially this wasn't offered across a wide range of population, but I think it was on April 5th, it became available to anybody over 16 for the Pfizer and anybody over 18 for the Mrna. So I spend a lot of my day now kind of going over this stuff. So just to kind of backtrack a little bit, if you look back to December, when the vaccine first came out of the trials, the Messenger RNA vaccine was first introduced. And even at that time, we knew that statistically pregnant women were at an increased risk for ICU admissions, for mechanical ventilation, being on a ventilator, and also slightly increased for actually dying from COVID. And based on that, the American College of Obstetricians and Gynecologists, as well as the CDC and Society for Maternal Fetal Medicine, they all recommended that the COVID vaccine should not be withheld from pregnant patients who meet criteria for the vaccine based on priority groups. Now, at that time, the only priority group that was pregnant that was available to get the vaccine would have been healthcare workers. And unfortunately, the Pfizer and Mrna trials both did not include pregnant women in their trials, which isn't unusual for vaccine trials to do that. It's pretty typical. We also see that with medications. So they were left to really make a decision on very little data. The only real human data available was the fact that based on observations from the women who actually became pregnant during the vaccine trials, they weren't showing any increase in miscarriage, preterm birth, or stillbirth. So that was somewhat reassuring. But other than that, there was really no data to go on. So we were left with just kind of explaining that based on the mechanism of the way the messenger RNA vaccine works, it was felt that it would one day be determined to be safe in pregnancy and breastfeeding. And so I think it's important to have some understanding of how this vaccine actually does work. You know, what they really did is they took the spike protein from the COVID virus and they figured out the genetic code. And with that, they were able to package that in a little, it's called a nano droplet. And when you get it injected with this vaccine into your muscle, it finds its way into a lymph node, and that's where it goes to work on your immune system. And important to note that the vaccine molecule never enters the nucleus, so it can't alter your DNA. There's been a lot of stuff on the internet about how the fact that it's going to alter DNA, that can't happen. It also breaks down very quickly, so we think it would never be around long enough to even cross the placenta. And it also contains no live virus particles, so there's no way to get COVID from the vaccine. So we're able to tell that to our healthcare workers who are pregnant, and then try to help them make a decision. And to be honest with you, the few I had that were pregnant at that time, we didn't have anybody take the vaccine. They just thought it was too new. They didn't understand how it could be developed quickly, and it turns out it can be developed quickly. It cost a lot of money, but they didn't actually cut any safety when they developed the vaccine. But I think there's good news, because last week we did get some more data that I'd like to share with people, both on the effects of COVID and pregnancy, and also some data related to what's been the vaccine usage in pregnant women so far. First, a little more of the data we know about COVID and pregnancy. There's a prospective longitudinal observational study that involved a little over 2,100 pregnant women. And they had two groups. They had the women who contracted COVID during April to August of 2020. And then they had a control group that they used to compare these women to. This big study involved 43 hospitals in 18 countries. And it looked at, the goal is designed to assess the association between COVID-19 and maternal and neonatal outcomes. And so they ran the study, and it was released last week. It appeared in Pediatric JAMA. And what they found was what we'd already known, which was that the COVID patients were at increased risk for ICU admission, mechanical ventilation, and increased risk for death. But it also found some other things that were not as widely known, and that was they found a higher risk for pregnancy-induced hypertension and preeclampsia, higher risk for C-section, higher risk for fetal distress, 3 times higher rates of infections requiring antibiotics, higher rates of preterm delivery. And these weren't really spontaneous preterm labor deliveries. There are more deliveries that need to be done for mainly preeclampsia and eclampsia. They also found higher risk of low birth weight infants weighing less than 2,500 grams. And they also found 6 times higher rate of being transferred to a higher level of care. So these were all things that kind of accentuate that COVID can be very serious in pregnancy, but it doesn't mean we need to go into panic about it. Most of the outcomes that were negative were associated with people who also had other comorbidities, namely high blood pressure, obesity, diabetes, chronic lung disease, those sorts of things. They also found that the presence of fever and shortness of breath in women with comorbidities really put them at higher risk for a negative outcome. So that's a little bit surprising to me that they found those other negative outcomes in pregnancy. But we also had a new study come out last week from New England Journal of Medicine, and this was the study on the vaccine data. This involved going through 30,000 pregnancy data points. And where they got this was from people who got the vaccine, and these would have been mostly healthcare workers, because they looked at people who had got the vaccine and completed the pregnancy. And I'll talk about that in just a minute, but they got their data from two places. One was from the VSafe voluntary smartphone vaccine app. And that's a thing that people agree to when they get their vaccine, they download an app, a free app, and they keep in contact with the CDC as the months go by. They answer questions and keep them updated on their progress. And so they had over 30,000 patients who've done that so far. And they've looked at, they had 14,000 patients who received Mrna and 16,000 patients who received Pfizer. So these are only the Messenger RNA vaccines. And it was between December and February is when these patients were enrolled. And they wanted people who had completed the pregnancy. So completed the pregnancy either means you had a live birth or essentially a miscarriage, a voluntary termination, or ectopic pregnancy. And what they did was they looked at the live birth rate, the miscarriage rate, the stillborn rate, the ectopic pregnancy and voluntary termination rate, premature birth rate, small for gestational age rate, and the birth defect rate. And what they found was that when they compared this data to the norms across what we've come to expect based on population data for years, these numbers in the vaccinated population were no different than the numbers in the people who never received the vaccine. So that was really good news to hear. And this is ongoing data too, because if you got pregnant back then, you haven't even delivered yet. So these were people who got the vaccine when they were pregnant. In fact, these were vaccines given during the third trimester mainly. The only few vaccines given during the first trimester were available data if the person happened to miscarry, but otherwise the great majority of these were given in the third trimester. So I think a couple things to remember is this is an ongoing study. A lot of these people have not delivered yet. This is still very limited data, and it doesn't really apply to the vaccine given in the first trimester and carried all the way through to the end of the pregnancy. That data is going to come later. But the message from the CDC is that the early data based on this VSafe surveillance and the VSafe pregnancy registry indicate that obvious safety signals with respect to pregnancy or neonatal outcomes associated with COVID vaccination in the third trimester. They didn't see any kind of red flags at all. And that's a good thing. And they also want to note that these findings may change as additional pregnancy outcomes are reported, the sample size increases. You need a very large sample size to detect rare outcomes. So there's going to be more data coming. Pfizer also announced that they're starting a randomized control trial, which is what we really need, involving 4,000 pregnant women between 24 and 34 weeks gestation. And this is going to involve 9 countries, but won't conclude until July of 2022. So I think with this new data, the take-home point is that we are learning more how negatively COVID can impact pregnancy. But the majority of those negative outcomes do seem to involve people with comorbidities. And we know the overwhelming majority of young pregnant patients are going to do well with COVID disease. I think take-home point from some of this would be that it's reasonable to counsel patients with comorbidities, like obesity, hypertension, diabetes, maybe cardiac disease, chronic respiratory disease, asthma, that they are increased risk for severe COVID when they deliver, or for severe COVID disease, and that based on the limited data in those particular patients, the benefits of the vaccine appear to outweigh the risks. I think that's pretty safe to say now. But also for those with lower risk, which are the majority of people, this is also good news for those people too. It's been a hard thing for people to try to decide what to do. And I think this data is going to help people at least have a better sense of which way they need to go. It's a personal decision for everyone. I think just from a practical standpoint too, when you think about labor, ideally, you enter labor in your best possible health, right? And regardless of risk factors or comorbidities, labor is hard enough without COVID. And, you may be pushing 2-3 hours, and it takes a lot of cardiopulmonary reserve. So even mild COVID is going to make that a lot harder. I think another practical consideration is that we know that COVID infection can complicate a surgical recovery. We've got studies that address timing of surgery, even after mild COVID infection, showing significantly higher risk of pulmonary complications within the first 4 weeks of the diagnosis. So a vaccination in the third trimester would also help avoid that potential situation of a C-section being complicated, because we know that about 26% of babies in this country are delivered via C-section. So I think some of this new data, it seems like it's been a long time in coming, but we're glad that we have some of it.
That's great, Dr. Jacol. Thank you. That was really good information and new information that I'm glad we shared with our viewers here. Before I introduce Dr. Sencer, I just want to remind everyone that if you don't have a physician like Dr. Jacol that you can consult, and you do have questions about the COVID-19 vaccine, we do have our Ask a Nurse hotline open. That is 231-935-0951. And you can call, I believe it's 7 a.m. to 11 p.m. daily to get your questions answered. So next slide, please. So we will have Dr. Jacol back for some additional questions, but now it is my pleasure to welcome Dr. Stacy Sencer, who's relatively new to Munson Healthcare, now practicing OBGYN in Gaylord and the Grayling area. And Dr. Sencer, I would love to hear from your perspective what you're seeing in your practice and what you're telling your patients. Welcome.
Thank you. I'm excited to be here. I look back and think of last year, March, and how this whole pandemic started, and it was only going to be a 2-week thing, and we were all going to be shut down for 2 weeks. And now here we are over a year later, and we're still battling this disease, this pandemic. I also I think it's ironic that I came from Florida, which was the epicenter of the COVID outbreak, and now I've moved to Michigan, and I feel like it's following me wherever I go. So I'm excited to try and educate people. I think we all are in the same boat where we want it to be over, and I feel that at this point in time, unless we get more people vaccinated, that we're going to continue to live in this COVID world, and it's going to continue on and on. 2 things I wanted to add to Dr. Jacol's presentation, which I thought was excellent. One is that also there was some literature that was came out that their babies are testing positive for antibodies after pregnant women do get the vaccine. So I think that's really important to let our patients know that not only are you, when you're pregnant, you're basically, we're, as obstetricians, we're taking care of 2 patients. We're taking care of the patient, and we're also taking care of the baby. So anything that we can do to try and help with that, we can get antibodies to that baby with a vaccine. I think that's also very important. Couple other things I want to tell people is that The data is starting to come in that the COVID vaccine is safe. It will keep you from getting COVID-19. I'm also part of a closed Facebook group where we have over 5,000 female OBGYNs. So you can only be in this group if you're female and only be in it if you're OBGYN, and everyone in that group that's either pregnant or breastfeeding has received the vaccine. And we've had excellent outcomes. We've had no adverse events compared to people who haven't gotten the vaccine. So I think that's really important, especially with social media out there. I love that group. It keeps me up to date on what's going on. And we have women from all over the world in that group. So I think that's really important also to know. The thing with the vaccine, and I feel this way after I got my vaccine, once I got the vaccine, I felt a little bit more comfortable that I was able to see my family, that I could gather indoors with other of my coworkers that have been vaccinated without having to wear a mask. It just gives you a little bit more freedom and protection. It's going to protect you from getting the disease. That's what we want. We want to build protection for everything. It also is going to keep you from getting some serious life-threatening complications. If you do get COVID after the vaccine, which is very, very limited and a very low risk, your risk of getting really sick is significantly decreased. At this point in time, we've had a shutdown, we've quarantined, we have done everything we can to try and stop this pandemic. And if we don't start to vaccinate the more of the population, especially here in Michigan, then I don't see how we're ever going to get out of the state that we're in. So I know, and I have friends who are in this boat. They don't want to get the vaccine. They think it's too new. They're just going to take their chances. I think taking your chances in this environment is too risky. I wouldn't want my family members to take the risk. I wouldn't want my friends to take the risk. I want my friends and all of my family to get the vaccine. The other thing that's really good, especially in the workforce, and this has helped us, especially in healthcare, if you get the vaccine and you have an exposure, you don't have to quarantine. And I will tell you that I have been exposed to 2 people since I've been vaccinated. First, my mother got it. After I was vaccinated, I didn't get it. And then also my son. My son came up here on spring break. Our spring break is in March from Florida. He was here, got COVID. And me and my husband were both around him. We've both been vaccinated, and neither one of us experienced COVID, got COVID or had any symptoms. So I will tell you that from experience, I know that the COVID vaccine works. A couple of things I want to say about the pregnant patient is that not only does COVID, most of our pregnant patients do very well after they get COVID during pregnancy. I'm always really concerned if they get it in the last 4 weeks of the pregnancy, because those patients tend to do worse. But the COVID causes a hypercoagulable state in pregnancy, and anybody, it causes blood clots. In pregnancy, you're already at that state. So even after you have the baby, if you've had COVID during the pregnancy, you can have some complications related to that. And I had a patient in Florida who had a baby after she'd had COVID in the third trimester, and she developed a blood clot in one of the veins inside the pelvis. She needed long-term anticoagulation after that, and it just became a big kind of difficult recovery and difficult postpartum state that we had to take care of because of her having COVID. The other thing is, so we as physicians, we want to have healthy moms and healthy babies. That's what we live for. That's what we do here. That's our whole purpose in life. We want to offer our patients everything that's out there that's going to help them have a healthy baby and to have a healthy pregnancy. This is an opportunity for our patients to receive that, to have decreased risk of having an adverse event. And I just think it's really, really important that they take advantage of this opportunity.
Thank you, Dr. Sensor. That was really great information. We're happy to have you here in Michigan at Munson Healthcare. And just real quickly, I see a lot posted on Facebook about you mentioned giving patients every tool that and a piece of advice that you can give them to keep them healthy in that. So I see a lot of people posting on Facebook that you don't need to get vaccinated. What you really need is just some extra vitamin D or, different ways to kind of boost your immune system. Do you agree with that? Or, I mean, obviously, I think you encourage people to get vaccinated, but,
Right.
how can, I think those kinds of things are obviously important. Everyone needs to stay healthy to boost their immune system and things
Right.
like that. But what is the added benefit of a vaccination if you're already doing some of those, additional things like taking vitamins and things
Right.
like that?
I'll tell you, my son is one of the healthiest persons I know. He's a high school senior. He works out every single day at 5 o'clock in the morning. He takes all these supplements. He only eats healthy, and he got COVID at the gym. Okay, so I am telling you that it doesn't matter what supplements, what other things you take, what your age is. And I will tell you, for an 18-year-old, he was quite sick for about 8 days. And my concern with him is that, yes, he recovered and he has done very well, but as an athlete, those post-COVID issues that can affect the heart and other things that we don't really know about have me a little bit concerned. And so as an athlete, they have to do some other extra things. They have to have an EKG afterwards. They have to do some other testing. And so the sequelae after a COVID infection, even in the healthiest individual, which is what I would consider my son, much healthier than myself, they still can get it, and they can still become very sick. And then the effects can be for quite some time.
Thanks. Yeah, I can attest to that as well. I have a relative who's does all the same things, extremely healthy, former athlete, and became very sick with COVID as well. So thank you for that information. I hope that helps some of the, the listeners out there and viewers who may be thinking that, I think there's especially a lot of younger people. I mean, when I was young, I'm not young anymore, but when I was young, I thought I was invincible and, my body could fight off anything. And, I think we're just trying to, again, give everyone the tools that they can to get us back to being outdoors or being inside without masks on, all that kind of stuff. So thanks. All right, so welcome back, Dr. Jacol, Dr. Nefsi. We're going to get into the Q&A session here, and I'm going to start with Dr. Nefsi since she is our pediatrician on the panel. We have 2 questions related to children. This is coming from one of our reporters. And I'm not sure if you know the answer to this, but would it be typical for a breastfeeding child to experience flu or cold-like symptoms after the mother's second dose of the vaccine? And is that common, and how soon would that occur?
I would say no. I mean, we hear anecdotally a lot of people say, oh, I got my flu shot and then I got sick, or I got this, and they're attributing it to actually getting the vaccine and then the virus. So since none of these vaccines actually give you the virus, you shouldn't also get symptoms of the virus. You can get side effects. The person who got the shot can get side effects from the vaccine of like a sore arm and feeling a little under the weather and that kind of thing, but they certainly should not be developing COVID symptoms related to the vaccine. That probably likely is just sort of just a coincidence and not related to the vaccine at all. So no.
I see, Dr. Jacol, you're shaking your head, or you're nodding your head as well. Is that common that this can't be passed on through breastfeeding?
Yeah. I think that when I got my Mrna, I got the Mrna vaccine, and the first shot was no big deal. Second shot, geez, I couldn't lift my arm hardly. 4 hours later, it was pretty sore, and then that night I had fever and chills, and what that is, that's just your immune system responding the way it's supposed to. So when you get sick with flu, a lot of the aches and pains and everything it's not necessarily the flu virus. It's what the flu virus is causing your body to respond with, and so that's what you're really experiencing. Like Dr. Nefsi said, when you get the actual shot, it stimulates that immune system, and that causes the aches, the headache, the chills, the fever, that kind of thing, if you get those things. They did find that when the pregnant women got the vaccine, though, the mRNA vaccines, they tended to get the sore arm, but not really much of the systemic stuff as much as people who weren't pregnant. They don't know why that is.
Interesting. Okay, great. Thank you. Dr. Sensor, I'll ask you to answer this one. Reading that this COVID-19 is becoming a young person's disease because vaccinations are blunting the impact on older people. What are your thoughts on this, and are you seeing that trend with your patients?
Yes. You know, when I feel that I'm older and seasoned, but when you're younger, you feel like you're invincible. Okay, that your health is the way it's always going to be, and it's not going to change. I think that's the group right now that we really need to target. We need to target the younger people. They're the ones that are getting sick. I think we've done a really good job of vaccinating our older population, but I think we need to really move forward and get out of this pandemic. We really need our younger people to step up to the plate and get the vaccine to protect themselves, protect their family, and so that we can move on.
Thank you, Dr. Sensor. This next question is for Dr. Nefsi. It's been reported by the New York Times that there's a nationwide trend of people missing their second or skipping their second COVID vaccine dose. Are we seeing that trend in Northern Michigan that you know of?
Yeah, you know, that's a little bit harder to track for us. Certainly we've been hearing that there are people who are just skipping their second dose. It's hard to understand sometimes whether they're skipping it or whether they just don't have access to it, that kind of thing. So with our vaccine steering committee, we are doing a lot of work to ensure that people can get their second dose if they want it. So, you know, early on when there was limited amount of vaccine, we were being very careful about scheduling second doses with first doses and calling people and making sure they were coming back and that kind of thing. We are seeing more people now say, hey, I got my first dose here and can I get my second dose? And so all of our health departments, and I'm sure our clinics as well, are you know, ensuring that if they have the vaccine, they'll give it to people for their second dose as long as it's in MICR and we can prove it. So we are hearing that. I think some of it also comes from some of the studies that you saw done overseas, where with the vaccine shortage, they were just trying to get as many people with one dose in. You know, though I think the science and the evidence with that is still being developed. And so we certainly wouldn't recommend doing that. So if you get one dose of a 2-dose vaccine, we would highly recommend that you come in and get your second dose.
And the good news is that the vaccine is more widely available right now. So as you mentioned, you don't necessarily have to go back to the same place you got your first dose, it sounds
Yes,
like. Okay,
absolutely.
That's great. That's really good to know. That was a good question. Thank you. Dr. Jacol, this next question is for you. Specifically, it says, what are your thoughts about the J&J vaccine for pregnant women, or should they stick to the mRNA vaccines?
I would say based on what we know now, I tell my patients to stick to the mRNA vaccines because that's the data we're getting. And given the fact that Pfizer is going to run that big trial that's going to be on an mRNA vaccine, that'll be the best data we have for pregnant women. So are they going to do wrong to get the J&J? Not necessarily, but if they want to kind of go with the data and make a decision based on data, that I think they're kind of going to be forced with the messenger RNA.
Okay, great. Thank you. I have a question here from a reporter about testing capacity for young children. The question is, I noticed that Walgreens and Rite Aid don't have test kits for children under the age of 3. Is testing capacity for toddlers an issue regionally? And maybe I'll ask Dr. Nefsi to take that one on.
Yeah, I think it's less about the testing being valid for kids and more that not everybody feels comfortable testing children. So, you know, certainly in our pediatric clinics and in our family medicine clinics and in our hospitals, we test children all the time if it's indicated before procedures or if they're getting hospitalized, those kinds of things. So, you know, the testing is valid for those kids, but sometimes when you're at a commercial pharmacy or that kind of thing, they just don't have people necessarily trained in small kids. And as a pediatrician, I can tell you, swabbing a 2-year-old is a very different experience than swabbing a grown-up. So it's likely just related to the experience of the personnel rather than the testing itself.
Okay, great. Thank you. This next question I'll ask to the panel, and maybe each of you could just touch on it from your own perspective. But we've vaccinated about half of the eligible population so far. I think those are some of the current numbers out there, at least that have the first dose. It seems the second half will be more challenging. What are your thoughts on that? And is Munson Healthcare asking any family doctors to reach out to their patients to encourage them to get vaccinated, or what is Munson Healthcare doing to address vaccine hesitancy? So I'll start with Dr. Jacol. What are you seeing in the Charlevoix area, and what are your thoughts on that?
To the 50% or whatever you're referring to who have not been vaccinated, I understand where some of those people are coming from. I think they're looking at COVID as a thing that if I get it, I'm going to be fine. But I think it's time to start looking at the bigger picture here. You know, this has been going on for over a year. I don't know about you, but I'm tired of wearing a mask everywhere I go. And the only way we're going to get past that is if we get past this infection rate. And the only way that's going to happen is people take the vaccine. And so for it against it, I think everyone's tired of wearing masks and social distancing and all. And if we're going to put that behind us, we have to get vaccinated. I mean, I think that's just a fact. And for the people who aren't on board with it, you know, everyone can make their choice, but you know, at some point we got to kind of get a little united on this and beat it.
Thanks, Dr. Jacol. Dr. Sensor, what are you seeing in the Gaylord and Grayling areas?
Yeah, I still think there is a, you know, for whatever, whether it's political or I don't know what happened at the beginning where there was some false information that was spread, you know, about being microchipped or who knows? I don't know. I feel like the same, that at this point we've been living this life for over a year now. Every time I see a patient, whether they're pregnant or not, I ask them if they've been vaccinated. So I'm trying to encourage everyone to get that. And I just think that, you know, I think a lot of people have waited because they were concerned about it being too new, but I do believe that I think there hopefully is going to be a big surge of people who are going to go ahead and get it now that it's been available, and everyone seems to do it quite well, and I think we should all encourage that.
Thank you. I think I'm having some audio difficulties. Dr. Nefsi, can you hear me?
I can. Mm-hmm.
Oh, okay, great. Having all kinds of technical difficulties this morning. So I think we have time for one last question. And Dr. Nefsi, it was earlier in the pandemic, you know, healthcare workers were just as afraid of you know, contracting COVID-19, I think, as everyone else in the community was. And you know, at that time, there were definitely challenges with PPE and things like that. How are we doing from a safety standpoint, keeping our providers, our staff safe? Because it seems that COVID-19 is not going away. Healthcare systems treat infectious diseases like COVID-19 all the time. They've always done that. So what are we doing to help keep our teams safe during this time?
Yeah, it's a great question, Diane, and you're right. You know, when I look back at my notes from when we started this pandemic, so much of it was about the availability of testing and the availability of PPE. We continue to track that and get reports regularly on that. And I can tell you, we have lots of PPE. Actually, we just recently launched our whole retesting for how your N95 mask fits. So we could ensure that everybody was retested at that year mark. So we have lots of PPE. We've got plenty of testing. We continue to screen all of our providers every day before they come in for their shift. And then we continue to strongly recommend that all of our providers get immunized as an added safety benefit. So I'd say we know much more about this virus in particular and have done, I think, a much better job being able to integrate those processes to keep our staff and our patients safe much more seamlessly and regularly into our daily work process and workflows than we did at the very beginning. So I feel confident that our staff is safe and they have the materials that they need to treat these patients and the rest of our patient population safely.
Great. Thank you, Dr. Nefsi. I also want to thank Dr. Jacol and Dr. Sensor for joining us today. It was really great to kind of dive into one specific aspect of COVID-19. I do want to just take a moment here. I know we're actually out of time, but I want to just take a moment to share the community resource slide again. Every other week, we try to have our health departments join us to give their perspectives. Hopefully they will join us next week. But again, this information related to the health departments and the 211 Michigan is available on our website as well. If you are still uncertain as to where to get a vaccination, please visit munsonhealthcare.org. Sign up for our e-newsletter or follow us on social media, and we can help point you in the right direction. And as always, as I keep mentioning, we do have our Ask a Nurse hotline that is available at 231-935-0951. So again, I just want to really thank our panelists. Thanks for all the great questions from reporters and from our viewers on Facebook. And we will be back next week at 11 a.m. again, and hope everyone has a great day. Thanks.
Thanks, Diane.
Thank you.
Thank you.